7 early warning signs. Your arteries are clogging. Your heart is pumping blood through 60,000 miles of arteries and veins right now. Not just circulating oxygen, but pushing pressurized fluid against the walls of vessels that are only a few millimeters wide. That pressure creates friction. That friction creates wear. And over months and years, that wear transforms into something far more dangerous than most people realize. Atherosclerosis is the most underdiagnosed killer in the developed world. It doesn't announce itself with chest pain or shortness of breath until you're already in serious trouble, usually in the form of a heart attack, a stroke, or sudden cardiac death. The problem is that for decades we've been told that high cholesterol is the primary villain. Cut your saturated fat, lower your LDL, and your arteries will stay clean. Except that hasn't worked for millions of people. What we're now understanding is that arterial damage begins years before cholesterol becomes a problem. And most people are walking around with arteries that are already inflamed, already accumulating plaque, and showing warning signs that are being completely ignored. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in AANDE, I've seen what happens when arterial disease isn't caught early. And my goal now is to help people recognize the warning signs before they end up in my emergency department and live longer, healthier lives. For the next couple of minutes, I'm going to walk you through 7 warning signs that your arteries are clogging. These aren't vague symptoms, these are specific, identifiable changes that your body produces when blood flow is being restricted. And I just want to take a few seconds here to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research to help you prevent the diseases I see every single day. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time, or you've not learned something new, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let's continue with the video. Before we talk about the warning signs themselves, we need to understand what's actually happening inside your arteries when they start to clog. Atherosclerosis doesn't begin with a cholesterol particle just sticking to a vessel wall. It begins with endothelial damage. The endothelium is the thin inner lining of your arteries, only 1 cell thick, and it's responsible for keeping blood flowing smoothly and preventing inflammation. When that lining gets damaged by chronic high blood pressure, chronic high blood sugar, oxidative stress from smoking, or inflammatory chemicals from visceral fat, your body treats it like an injury. White blood cells called monocytes migrate to the damaged area. They burrow under the endothelium and start consuming oxidized LDL cholesterol particles that have also accumulated there. Those cells transform into foam cells, which are essentially immune cells bloated with fat. As more foam cells accumulate, they form a fatty streak. That streak grows into a plaque, and that plaque can either stay stable for years or become unstable and rupture, which is what causes most heart attacks and strokes. The key point here is that plaque formation is a process driven by inflammation and endothelial dysfunction, not just by cholesterol levels. This is why people with normal cholesterol can still have severe arterial disease. This is why statins work for some people and barely help others. And this is why the warning signs we're about to discuss are showing up years before a blood test flags anything as abnormal. Warning sign number 1 is erectile dysfunction in men under 60. This is not a minor side issue. Erectile dysfunction is a vascular problem. An erection requires the penile arteries to dilate and fill with blood. Those arteries are some of the smallest in the body, typically about 1 to 2 millimeters in diameter. When atherosclerosis begins to narrow those vessels, blood flow becomes insufficient. What makes this significant is that erectile dysfunction often precedes coronary artery disease by 3 to 5 years. A study published in the Journal of the American College of Cardiology found that men with erectile dysfunction but no cardiac symptoms had a 58% higher risk of cardiovascular events over the next 10 years compared to men without it. The penile arteries are the canary in the coal mine. They're showing you that the disease process is already active in your vascular system, and the coronary arteries that feed your heart are likely being affected as well. Warning sign number 2 is a crease in your earlobe. This sounds bizarre, but it's one of the most well-documented physical findings in cardiovascular medicine. It's called Frank's sign, named after the physician who first described it in 1973. The crease is a diagonal line that runs from the tragus, that's the small piece of cartilage in front of your ear canal, down to the lower edge of your earlobe at about a 45-degree angle. What's happening is that microvascular disease in the tiny blood vessels that supply the earlobe causes the tissue to collapse slightly, creating that crease. Multiple studies, including one in the American Journal of Medicine, involving over 1,000 patients, have found that people with Frank's sign are significantly more likely to have significant coronary artery disease, even after controlling for age, smoking, diabetes, and other risk factors. It's not diagnostic on its own, but it's a visible marker that your small vessels are already being affected by atherosclerosis. Warning sign number 3 is intermittent claudication, which is leg pain that occurs with walking and goes away with rest. This happens when the arteries supplying your legs, particularly the femoral and popliteal arteries, become narrowed by plaque. When you walk, your leg muscles need more oxygen. But if the arteries are partially blocked, they can't deliver enough blood to meet that demand. The muscles become ischemic, meaning they're starved of oxygen, and that produces a cramping or burning pain, usually in the calves, but sometimes in the thighs or buttocks. When you stop walking, the oxygen demand drops, the pain resolves, and you can start again. This is called peripheral artery disease, and it's a strong predictor of coronary and cerebrovascular disease. If your leg arteries are clogged, your heart arteries and brain arteries are almost certainly affected as well. Studies show that people with peripheral artery disease have a cardiovascular event rate of about 5 to 7% per year, which is substantially higher than the general population. Warning sign number 4 is xanthelasma, which are yellowish cholesterol deposits that appear on the eyelids, typically near the inner corner. These are not just cosmetic, they're a visible accumulation of lipid-laden macrophages under the skin. Research published in the British Medical Journal followed over 12,000 people and found that those with xanthelasma had a 48% increased risk of heart attack and a 39% increased risk of ischemic heart disease over 30 years. What's particularly interesting is that this association held even in people with normal cholesterol levels. Xanthelasma indicates that your body is already in a state of dysfunctional lipid metabolism, and that cholesterol is being deposited in tissues where it shouldn't be, which almost always includes your arterial walls. Warning sign number 5 is a reduced ankle brachial index. This is something your GP can measure in about 5 minutes with a blood pressure cuff and a Doppler device. The test compares the blood pressure in your ankle to the blood pressure in your arm. Normally, they should be about the same. If the pressure in your ankle is significantly lower than in your arm, it means the arteries supplying your legs are narrowed. An ankle brachial index below 0.9 is considered abnormal and indicates peripheral artery disease. What makes this test valuable is that it's objective. It's not based on symptoms. Many people with early arterial disease have no leg pain at all, but the reduced blood flow is measurable. And just like with intermittent claudication, an abnormal ankle brachial index is a strong predictor of heart disease and stroke. Warning sign number 6 is arcus senilis in people under 50. This is a grey or white ring that forms around the cornea, the clear front part of your eye. It's caused by cholesterol deposits in the corneal stroma. In older adults, it's extremely common and generally benign. But when it appears before age 50, it's associated with familial hyperlipidemia and significantly elevated cardiovascular risk. Studies have shown that younger people with arcus senilis are more likely to have extensive coronary artery disease and a family history of early heart attacks. It's a sign that lipid metabolism is severely disrupted and has been for years. Warning sign number 7 is a prolonged capillary refill time. This is the simplest test you can do at home. Press down on your fingernail for 5 seconds until the nail bed turns white, then release and watch how long it takes for the colour to return. It should return in less than 2 seconds. If it takes longer than 3 seconds, it indicates poor peripheral circulation. Capillary refill time reflects how well your small vessels are delivering blood to your tissues. A prolonged time suggests that microvascular function is impaired, which is often an early sign of systemic vascular disease. It's not diagnostic by itself, but combined with other warning signs, it's worth investigating further. Now here's the critical point that most people miss. These warning signs don't appear because your arteries suddenly became clogged. They appear because the process of atherosclerosis has been active for years, possibly decades. Arterial plaque doesn't form overnight. It accumulates slowly, layer by layer, in response to chronic endothelial damage. By the time you're seeing erectile dysfunction, or earlobe creases, or leg pain, the disease is already established. The good news is that arterial disease is not a one-way street. Endothelial function can improve, plaque can stabilize, inflammation can be reduced, but it requires addressing the root causes, not just treating the symptoms. The mistake most people make is assuming that if their cholesterol is normal, their arteries are fine. That's not how it works. Cholesterol is one factor, but it's not the only factor. Chronic inflammation from insulin resistance, oxidative stress from smoking, endothelial damage from high blood pressure, all of these contribute to plaque formation even when LDL cholesterol is within normal range. This is why statins work for some people and don't prevent heart attacks in others. They lower cholesterol, but they don't necessarily reverse the underlying inflammation or improve endothelial function. So what actually improves arterial health? 3 things. First, you need to reduce systemic inflammation. That means addressing insulin resistance, which is the primary driver of chronic low-grade inflammation in most adults. High insulin levels activate inflammatory pathways, increase oxidative stress, and impair endothelial nitric oxide production, which is the molecule that keeps arteries relaxed and prevents plaque formation. Reducing refined carbohydrate intake, improving sleep, and regular physical activity all reduce insulin levels and lower inflammation. Second, you need to improve endothelial function. Aerobic exercise is one of the most powerful interventions for this. When you exercise, the increased blood flow creates shear stress on the arterial walls, which stimulates the endothelium to produce more nitric oxide. That nitric oxide dilates blood vessels, improves blood flow, and reduces the likelihood of plaque formation. Studies have shown that regular aerobic exercise can improve endothelial function within weeks, even in people with established cardiovascular disease. Third, you need to stop introducing new damage. That means controlling blood pressure, quitting smoking, and reducing exposure to oxidative stress. High blood pressure physically damages the endothelium. Smoking introduces free radicals that oxidize LDL cholesterol, making it more likely to be taken up by foam cells. Chronic high blood sugar glycates proteins in the arterial wall, making them stiff and prone to plaque accumulation. All of these are modifiable. In emergency medicine, we see arterial disease in its most dangerous forms: heart attacks from ruptured plaques, strokes from carotid artery blockages, acute limb ischemia from complete arterial occlusion. What becomes obvious when you work on the front line is that these events are almost never sudden. The disease process was there for years, the warning signs were there, they were just ignored. The patients who avoid these outcomes are the ones who recognize the early signs and take them seriously. A 50-year-old man who develops erectile dysfunction and gets a coronary calcium score has the chance to intervene before he's on my resuscitation table. A woman who notices leg pain when walking and gets an ankle brachial index measured can start treatment before she has a stroke. Early detection doesn't just improve outcomes, it prevents the catastrophic events from happening in the first place. So where does this leave you? The 7 warning signs we've discussed are not diagnostic. They're indicators. They're your body's way of telling you that blood flow is being compromised and that the process of atherosclerosis is already underway. If you have one or more of these signs, it doesn't mean you're about to have a heart attack. It means you need further investigation. That might be a coronary calcium score, an ankle brachial index, a carotid ultrasound, or a stress test. The goal is not to create anxiety, the goal is to create awareness. Because arterial disease is preventable, it's treatable, and it's reversible in many cases if it's caught early. but it requires you to pay attention to the signals your body is giving you and to take action before the damage becomes irreversible. And finally, just to end, please subscribe to the channel if you found this useful to help me reach more people like you.